On the line. When you are ready to begin the presentation, press the Start Broadcast button on the GoToWebinar control panel.
Good morning, everybody. This is Whitney over at Health Trust Software, and this morning we are going to be looking at the Health Trust Software Hospice beta testing portion of the software. So I've already logged into the system here, and the first thing that we're going to actually look at is how to set up those different types of hospice visits actually in our system so you guys can utilize that beta testing program. Now, the beta testing, if you are actually interested in beta testing our hospice program, let our training department know at training@healthtrustsoftware.com. We will be actually releasing it. It has been in beta testing for a little while now, and we will also be opening that up and releasing the hospice version to our other agencies as well. Hopefully that will be soon, but for right now it just is available with the beta testing. So the first thing that we're going to actually do is we're going to look at the settings for the actual visits themselves, the services, what you guys need to add into the system before you can really utilize that hospice beta testing. Okay, so under our reference tab, as many of you guys may have known or done yourself, whenever you first started with our software, we had to set up the actual services. So we're going to go into the Reference and then Services tab to set up those different types of hospice services that we'll need to have access to our schedulers so our field staff can actually fill out those correct types of visits. You'll have to bear with me. My internet is just a little bit slow this morning. Now, once you're under that Reference and Services page, this will actually show you a list of all of the different services that you have listed in the system. You have your alphabet across the top of the page so that you can actually search for different types of visits that you're looking for if you may have already set up different types of visits. Otherwise, you also have your advanced search, your add and view categories, and then also your add service option. Now in this case, we're just going to choose add service, and that's going to take us into our add service page where we can actually set up these different types of hospice visits. Now before we talk about some of the boxes that are listed above here, let's look at the type of record. Now the type of record is probably going to be one of the most important fields on this page, especially if your field staff are going to be using the point of care program, because this actually determines what type of record or what form your field staff are actually filling out when they're completing that documentation. If we use our drop-down box here, you'll actually notice that out to the left-hand side of quite a few of these visits, we have the word hospice. These are going to be all of the different types of hospice visits that we provide you guys with in the system. So you'll notice we have your bereavement assessments and visits, your chaplain assessments and visits, a discharge visit, a hospice home health aide visit, medical social worker assessment, and also eligibility assessment, as well as the medical social worker routine visit, a PT assessment, a skilled nursing eligibility assessment and recert and routine visit, a supervisory note, and also a volunteer note. What you would want to do for an example, let's say that we were trying to add in a bereavement assessment into our software so that we had access to this. The code maybe at the top could be hospice dash bereavement, if you want to abbreviate it. Remember, anything that you type in lowercase letters, as soon as you click submit, the system will actually save it in uppercase letters. and it does tell you the last code that you created. I would recommend, just to make it a little bit easier for your schedulers, always including in the code maybe the word hospice or start it with hospice. That way it kind of groups those different types of records together in that scheduling screen when your schedulers are going in and looking through those visits and actually placing them on your clinician's schedule. The description would just be whatever you want to appear at the top of that visit note. So in this case it may be hospice, bereavement, assessment, or kind of whatever you guys would like to call it. Your category, you have different categories set up here. Now remember, when we went to reference and services initially, we did have an option to the right hand side before we clicked on add service that said service categories, okay? So you can click on that to actually set up these different categories. So if you wanted to set up one that was specific to hospice, you could. And then just select the most appropriate one out of this list. For the sake of this training, I'm just going to choose skilled nursing here. Remember that type of record needs to be the actual form that your clinician would be filling out when they're doing that visit. The status when passed means once that visit is completed and it's turned into the office, once it passes care validation and has been reviewed and is ready for billing, this is the status that it needs to go into. If it's a billable service, make sure that you have this status when passed set to confirmed. If it's a non-billable service, make sure that you have the status set to a rev adjustment. That way it never actually shows up in the billing menu. You can also enter in the cost that it cost your agency to complete the visit. And then once you click submit in the upper right hand corner, that's going to refresh the page for you. And then that'll actually upload or give you a new pricing tab so that you can add in the actual pricing that you would bill that visit. So you see now we have our pricing tab here. When I click on it, even if it's a non-billable service, you always want to add in a generic price. Now, if it's non-billable, remember we set this status when passed to rev adjustment. So that means that it's not going to show up in the billing menu. But if it does, what I like to say is over on the pricing tab, when you're adding in the pricing so it shows up in your schedulers menu, just add in maybe a generic HCPCS and revenue code, and then actually set the charge amount or the billing amount to just $1 or something like that. So it also gives your biller a visual flag in case someone goes in and changes that status or it happens to show up in that billing menu. But again, as long as you have it set to rev adjustment, it should never show up in that billing menu to begin with. But again, just enter in that HCPCS and revenue code, just a generic one. Again, we're not billing it if it's a non-billable visit. If it is a billable visit, make sure that these are accurate because that's what's going to be included on that particular claim. Enter in your charge amount and whether it's per visit or per unit and how you'd like the system to calculate that billing quantity. There are a couple of other options here. If you guys have questions about setting up these individual services, let our training department know. You can shoot us over an email at training@healthtrustsoftware.com, and we'll be happy to walk you guys through that or send you a step-by-step on how to set up those pricing. Click Submit to save it, and then that would add it here to your pricing list. You've already hit Submit, so you don't need to click Submit again unless you had gone back and changed something on the main page. And now your actual hospice bereavement assessment is in the system and available for your schedulers to assign to your actual field staff who would be completing those types of visits. Now another type of record that we also saw in this drop-down box was going to be a hospice HHA visit or a hospice home health aid visit. Okay. Now for any of those agencies out there that are actually doing home health aid visits right now, maybe on the Medicare side of things, if you're actually customizing those tasks and different options that your home health aides have available to just kind of check off in the point of care program, then this is going to be the same process. However, if you've never actually used the home health aid portion of our software, whenever you're creating that care plan for the home health aid visit, under your Orders tab, we actually have an Aid/Attendant CP menu. And if you select that menu, what that's going to do is take you to a page in the system that actually has a list of all of those aid care plans that have ever been completed in your software or in your database. Now to the right-hand side, you have an Add New Plan, so if you needed to actually create one from the online system, you could. You also have your advanced search and your alphabet, just like the other pages. But what we're going to look at is actually going to be the Add/View categories. Now what this option is going to allow us to do is to customize the different tasks that hospice aide would need to be able to have access to, or maybe that the nurse creating this care plan would need to have access to in order to select the appropriate tasks that need to happen while that hospice aide is with the patient. Okay, so you have 3 different columns here that we're mainly going to focus on. The type, which would be basically the type of aide that's going to be doing that visit. The category, which just allows you guys to group together those different tasks in different ways. Like for example, we have personal care task here, then transfers, and then we also have a vital signs category. And then we have the actual task itself. So the different things that aide would actually be performing with the patient. The red X's to the right-hand side of each one are going to erase them. So if you needed to clean out some of this list. And then at the very bottom is where you have the capabilities to add in that task. Use the drop-down box to actually choose the type of aide. If you don't see the aid that you're looking for in this list, you can choose the most appropriate one, or just choose the generic home health aid so that you guys can customize that list. And then enter in the category, which again is how the system kind of groups together those different tasks. So it's that second column. And then the task is actually going to be that third column, and that's what the task actually is itself. So eating, transfer, dressing, things like that. Click Submit, and that's going to save that task to the list. And what that's going to do is when you're actually creating that aid care plan, if I were to add one in from the online system, the first thing that I see is going to be the type of care plan. So let's just pretend that I had entered in home health aid. What that's going to do once I select that type is my page is going to refresh, and it's going to load the different tasks that I have linked to that home health aid type. And those were the ones that I just filled out on that previous page that we looked at. That way you can just go through and check off the different ones that need to be done and the frequency, enter in any special instructions, and that way when your home health aides, your hospice aides are using that point of care program to complete their documentation, they actually see only the ones that were selected here. Now let's actually look at the point of care program, and let's look at different types of hospice visits. Now we briefly looked at kind of just the bereavement visit when we were adding in a service and how to set up these aid tasks, but again we saw many different types of hospice visits in that list. So let's look through those real quick in point of care. So I actually have my offline version of point of care open here. Some of your field staff who may be familiar with using the offline version may be familiar with this window. This is the program that's downloaded actually onto your Windows-based operating system or your laptop, and it actually runs with no internet connection. You only should need an internet connection to synchronize, and we recommend that you guys synchronize just at least once a day. Now I've already synchronized my computer back on the 9th, but I actually know that I have my hospice visits on here that I need to show you guys for the training today. So I'm just going to click on my schedule button, and that's going to take me directly into my schedule program. And then that's going to show me a list of all of my different types of visits that I have on my schedule. Now, this being our training program and our training database, I have a little bit of everything. Obviously, your hospice notes or your field staff doing these hospice visits are only going to see the types of visits that they would actually need to complete. So for example, we have our hospice aid note here. I'm just going to click on that blue colored bar and click on Start Visit. That takes me directly into my visit information page. I still have the same options that I have in my routine visits and my other types of visits that are in the system. So if it's a missed visit, I can document that. But let's look at the pages up here in our Quick Jump To box. There's not a whole lot of pages in this aid visit. You have your visit information page. The next page is going to be vital signs, again with those customized vital sign parameters maybe out to the right hand side, or you can utilize the little question mark to view any previous answers so that you guys can kind of see maybe how their blood pressure has been doing the past several visits. Once you get to your aid task page, I actually don't have an aid care path entered in for this particular episode, but this is where that care path or those different aid tasks that we had selected will just show up, and your clinician that's actually doing this visit can just simply check off the checkbox for the ones that were done and then enter in any additional comments to the right hand side. You have an additional page for any additional information that she may need to document, any supplies that were used, creating a communication note or any care coordination, and then patient signature fields, of course, with your alternate signing options. And then the very next page is also going to be your aid signature, your clinician signature. Again, with alternate signing options, I would recommend signed with username and password if you're having trouble getting this signature pad here to load. Now, if you get into this page and you actually don't see this big white area here, make sure that you have Flash Player installed on your computer. That's typically the most common problem, and why this box doesn't show up for some computers is because it runs actually off of Adobe Flash. So just make sure that that program is installed on your computer. If you have any questions, we can always help you with that as well. And then once you finish this visit, the green check mark is going to save and validate all of your answers, show you any error messages that you may need to correct or any warnings. And then your red X is just going to save and close this visit and take you right back out to your schedule. Now we're going to kind of breeze through a lot of these different notes just so you guys can get the general idea of what they look like. If you need to set up additional training, just talk to our training department and we can see if we can set you up with additional training, or we can get you pricing for additional hours of training, or talk to you about beta testing if you're interested. But let's quickly look at the bereavement assessment. You have your questions about where the assessment was actually completed, your typical start and date times, the date of the patient's death. You have your basic patient information on the very next page, your actual bereavement assessment, so the family support system and the assessment questions itself. Anytime you see these comments box here, if there's a little up and down arrow button on the right hand side, you know it actually is an unlimited text box, so you guys can type in as much as you may need to. And then you also have an unlimited additional comments text box at the very bottom if you need to add in any additional comments. Your different bereavement risk factors, and then additional comments. Your clinician signature, and then that's going to be your last page, so the green check mark will save and validate that information. The red X is just going to save and close and take you back out to your schedule. Now, if you are actually filling this out to turn in to the office and you're completely finished with it, it's ready to go to the office, make sure that instead of clicking that red X, you click the green check mark and then synchronize your offline version of point of care. That way it gets sent to the office so they can review it and pass or fail that visit back to you. Let's look at just the routine bereavement note. You have your NA option for your mileage. And then again, you just have, basically 3 or 4 different pages here. Your second page is usually always going to be your patient information page, so it just kind of gives you some basic demographic information about that particular patient. Your counseling page that gives you the family or support person or support system and gives you information or gives you fields where you can document different demographic information. Clinical counseling and additional comments. And then your clinician signature page. Looking at the next one, it's going to be our chaplain assessment. So let's quickly look at that. All of these pages that we're going through always are going to, or all of these visits that we're going through are always going to start out with the visit information page. So this is always going to be that first page that you see when you actually start your assessment. Clicking on the forward arrow button is always going to move you to your second page. And then your quick jump to category box is just simply going to give you a list of all of the different pages throughout that assessment. Moving to the next page, you have your spiritual/religious affiliation. A lot of these are just simple check boxes. We do provide you with some unlimited text boxes down here at the very bottom to fill out. Your spiritual assessment. And your patient signature, and then of course the next page is going to be your clinician signature. Looking at the chaplain note, a lot of the routine notes may work very similar to the other ones that we've actually seen. The questions are just going to vary depending on the type of person that's actually completing the visit. So on the second page of our just plain chaplain note, we have our patient information again. We also have our spiritual assessment page with a lot of the same questions that we had just seen on those other visits on the actual chaplain assessment. Your patient signature page, and then your clinician signature. Let's look quickly at the hospice discharge. A few more pages here. But again, your first page is always that visit information. Second page is normally always your patient information. Your vital signs is the third page of this discharge. Any discharge information. Now, I don't particularly have anything on this patient that I've chosen in our test database, but they do actually have some medicines that show up in that medication profile. You have your DME and supplies page, your additional page, any additional documents that you need, as well as some of these pages that you guys may be familiar with from your other disciplines. Your clinician signature. You have that green check mark to save and your red X to save and close. Your hospice PT assessment, just quickly looking through, you guys kind of get the idea of all of these different types of visit. Here's your nursing assessment with the different fields. Now, this is typically going to be similar to some of the nursing visits that you guys may already be familiar with. So kind of flipping through these different pages. If you have any questions or would like to see any of these notes in a little bit more detail, contact our training department at training@healthtrustsoftware.com, and we can set up a time to walk you guys through these different notes as a part of our new user manual. And also, once we release the actual hospice system, you guys will have training materials on these, and we can also walk you through or do a webinar for each of the different types of visits that your staff would be filling out. So as you have questions, let our training department know. That email again is just training@healthtrustsoftware.com. I'm going to post this webinar so you guys can go back and watch it and let us know as you have questions. Thanks for watching.